Yes, I was muted. Thank you. I'm very
All
happy that
again.
I have the chat. Wonderful. Okay, I'm going to do the whole spiel again. Um, Welcome everyone to the Intuitive XR chat. Today I'm very happy to have a fantastic guest to speak about Neuralink and invasive brain-computer interfaces. So I'm going to give a short introduction to Timon Merk, who will be our guest today. Okay, sounds great. Thank you for feedback. Okay, Timon Merk is a PhD student at the Charité Berlin, and he has a master's degree in movement disorder and neuromodulation, also from the Charité in Berlin, and then he was working at uBlocks as a machine learning engineer for a while, and afterwards, after a brief visit at Harvard Medical School, he is now back at the Charité Berlin as a PhD student, working with deep neural network approaches for closed loop deep brain stimulation using cortical and subcortical sensing. These are many fancy words, so maybe let's try as a quick introduction, let's try to summarize this for human people to understand.
First, thanks a lot, Marius, for the invitation. It's for me, really first time that I get invited to something like this. And yeah, so after my master studies, I got fairly interested in neuroscience research, and I was studying at the Bernstein Center for Computational Neuroscience in the master. That was really theoretical, and I was always looking for some link to practical applications. How can we help people? How can we somehow address neurological disorders? Because a lot of people are suffering from those movement disorders, psychiatric disorders. And at one conference, I got in touch with, so that is now my PhD supervisor, Professor Julian Neumann from Charité. And they work with a technique that sounded really crazy at that time, almost like science fiction, which is called deep brain stimulation. And even the name already is very scary a bit. That you have electrodes that are implanted in the depths of the brain, and they somehow work for treating Parkinson's disease very well. And it was astonishing. They showed some videos of people that were having very severe tremor, and then this was all DBS off, and when on, the tremor immediately stopped,
Wow.
like magic. So that was really crazy to see, and I somehow wanted to understand how it works, what they do there at all. And so I joined this laboratory. I joined the movement disorder clinic at Charité that we're doing that successfully for, I think, pretty long time now. And I could also see it live in some surgery or OR session where the patient was awake
What's an
and
OR session?
was undergoing operation room. So that's why the patient got surgery to get the electrode implanted, and then so there's some debate if it's better asleep or awake. But in this case, it was awake, and yeah, I could first time see how they did the whole procedure, turned DBS on, off, changed some parameters. I could also see the burr hole, the open brain kind of, and the whole device. It was really exciting. And then I decided to do a PhD in this area.
Wow. Yeah, I
And
remember when I
I,
studied, we saw videos of these kind of procedures, and I was really blown away by the fact that these were done with people awake. So
yeah,
people are really awake, and someone drills a hole in their skull and
yeah,
implants electrodes, and then they give feedback on how it works while they are awake, and someone is drilling a hole in their skull. It's very,
yeah.
let's say, interesting to think about this.
It's really astonishing when you hear it the first time, I think.
Yeah.
And also for me, I studied beforehand neuroscience, and we did not really talk about it that much, that it was still a topic that exists in medical practice. But I think it somehow, maybe that makes also a bridge to Neuralink, somehow in the public awareness, it wasn't that strong. And yeah, at this time, so in the OR, they do a bunch of tests. For some patients, they usually test the things that can somehow tell if the disease or the pathology, as they call it, is alleviated, if it gets better. So that might be even playing a musical instrument. They also recall seeing a video of someone playing the trumpet or the violin in the OR
Wow.
to see if the stimulation works or gets better. So I
So
can
they're
really encourage
sitting.
people. Yeah,
They're
they're lying, I think. I think it depends also on the disease. So
okay.
now they use DBS for the brain stimulation, short DBS, for Parkinson's disease very frequently, but also essential tremor, dystonia also. So for a lot of movement disorders, it works if medications at one point don't work anymore. And therefore, those cases, it was shown to be really successful. Actually, also since I think more than 20 years it's used in medical practice. That it has a long history, and it's all specific that they target this one structure in the depths of the brain of a part called the basal ganglia, one specific nucleus called the subthalamic nucleus. And if you stimulate there with fairly established fixed parameters, then you can reduce the symptoms or alleviate symptoms of this of the diseases. And yeah, I was wondering how that works, first of all, and I figured out that it was also not that well understood why it works at all, what are the effects of stimulation, what are the parameters that kind of improve it, that do it best, and how can we use it also for other disease types like psychotic diseases, depression, obsessive compulsive disorders. And for a lot of those questions, I figured out that you measure very complex signals in the brain of a lot of neurons, millions of neurons, in fact, that give rise to the potential you measure at the electrode. And one tool that is very useful for that, to analyze that, to quantify, and also to hint which kind of parameters are best for treatment, is artificial intelligence or machine learning. And I guess that it was very helpful because we studied some of those concepts, and AI is also an incredibly hyped topic right now. That's when I studied at TU Berlin. I think you also were at TU Berlin, right?
Yes, yeah. I did my PhD there. Yeah.
I remember that I took the machine intelligence lecture there.
Yeah.
I was sitting half of the time on the floor because there was
Klaus
so
Robert
many
Müller.
people. Yes.
Yes, yeah. I didn't
Also,
actually take the lecture, but I've heard the stories.
it was really complicated, very, very mathematical. So many people were attracted by this lecture. That it somehow just shows how much hopes people have also on this method, or how fast it accelerated in the previous years. And
it really did, right?
Yeah, one of the really good applications for that, I think, is neuroscience, where we don't understand many aspects about the brain, many aspects about the signal that we are recording. And there are a lot of questions about decoding, supervised, unsupervised learning, reinforcement learning. So all of the typical domains of machine learning that could be really applied in this kind of research area. And with those ideas, I then came to to my supervisor back then and said, I want to do a project that does both. And that was pretty nice because at this time in the clinic at the neurology department, this kind of methods were not established. There were not so many people that somehow studied at the technical university or studied engineering, computer science, and then went to the clinics. And for me, that was a bit weird in the beginning because I was surrounded all the time by medical doctors that didn't really understand me. I didn't understand them.
Yeah, I can imagine. It's
But
a very different world.
yeah, but it's also really cool to kind of see what they do, to see patients, to interact and do some measurements, to even be able to talk with them and see the effects of medication, of the therapy itself. And that was really valuable and also motivating. Sometimes also just to see suffering of the disease. Beforehand, it was really abstract what some medical severity scores mean, but then I sometimes saw how much impact such a therapy can have in patients' life already right now with established medicine. And yeah, during the PhD, I then so I developed a Python toolbox that can be used for analysis of neural data of invasive signals. So we record them from the brain in different areas, and commonly those kind of need to be transformed into features or into other signals that are more interpretable or that can be used for machine learning methods. And this was not available for invasive signals so much, primarily because there are also not that many labs yet that do this kind of research, because it's still kind of the beginning of invasive brain-computer interfaces.
And it's probably also difficult to find patients, right?
Yeah, and that's very few, in fact.
Yeah.
So they have a lot of criteria that they participate. There shouldn't be any comorbidities. They should also, well, of course, no patient will be forced to participate in research.
Yeah.
So we are very, very lucky if patients agree and are also taking on such additional, sometimes days of recordings that they don't really benefit themselves, but we can then use the data to improve treatment in the future. And yeah, so during that time, then I got in touch with different data sets also, with different centers. So I didn't only analyze data from movement disorder patients, but also from medication-resistant depression subjects that were also planted with the brain stimulation electrodes, also at Charité. And then also, that's why the connection to Boston came at Massachusetts General Hospital. There were also epilepsy patients that were also treated with an implant to treat epilepsy. And yeah, so those are very different diseases, but we could kind of use the same method for all of them. And therefore, I got in touch. And it's quite a privilege, I think, still to work with this data, to analyze it, to build methods for those, and potentially also to see that they could be improved in the future. So
absolutely,
that's a bit in a nutshell how I came to research, and
great.
to that now.
Yeah, thank you very much. This is super impressive. I've never done anything with invasive PCI. My specialty is EEG, but I did work with patients when I was a student in Tübingen. I worked with ALS patients, and it was quite frankly very frustrating because you could see how fast and how severe the disease is progressing, and it was very, very also emotional to see that, and clearly the technology that we did there was not ripe for being a full-blown product, and the participant himself, he wouldn't benefit anymore, and I think these patients are the real heroes in this case, right? They know that their life is ending and that their time is very precious, and they still volunteer to spend their time. That's really heroic in this situation.
I totally agree. I think it's super clear, without the patients, we couldn't do any research. There would be no analysis. So I think that's why it's also super important to make use of the data as good as possible, which goes in the direction of open science, sharing data.
Yes.
Not only do experiment 1 and then repeat the same thing for another patient.
Yeah.
And I mean, we also try to tell them every time, and there are a lot of patient engagement initiatives to somehow appreciate that effort.
Yeah, that's really nice to hear. So there are so far no questions from the chat, but I see that we have a few viewers, and just to be very clear, feel free to send questions and comments whenever you feel like it, and we'll try our best to come back to them if we see them. So maybe, as long as there are no specific questions in the chat yet, maybe you could just give us an update about what's happening at Neuralink at the moment, so that we have a fundament, a basis to talk about.
Yeah. So first, I need to give a disclaimer. I don't work at Neuralink. I never worked at Neuralink. Maybe in the future.
Do you want to? Well, maybe we come back to that question.
Topic for later on.
Yeah.
But So what I can tell right now is purely based on the videos that were published, also the publication that they published in 2019, and specifically last year also, where they did the 2-hour streaming, which was quite nice as a technical dive into a lot of the engineering challenges that they were working on. The very big news, I think, is that they announced, so this is now a couple of months, I think in May or April, that they got FDA approval. So this is the US Food and Drug Administration that grants access or approval for clinical trials. And this is for clinical trial in humans, also with ALS patients or patients with spinal cord injury or quadriplegia. So they have really limitations moving legs and arms. And that's quite a big step, so that they can implant their device in those patients and also have over this time the opportunity to build a movement control application with those patients. And they published also on their website some blog post about the clinical trial. So it's I think the implant that they presented beforehand, which is the N1 chip. So this one consists of 1024 channels. It has 60 threads, so individual electrodes that come from this implant. And the idea is to gather signals from those electrodes and then control the computer with those signals. Maybe I can also briefly, if people or some viewers are not familiar with what Neuralink did so far or what they presented, the two main products or the two main approaches that they went for is first an implant and second a surgical robot. The implant, so as I mentioned, it's called N1. That's for sensing and stimulation. It's a wireless device that can be charged also wirelessly. And I think they mentioned that they can go for one whole day without charging. And on this device, they have threads that are electrodes that go in the depth, that go inside of the cortex of the brain. With so far, I read that the maximum penetration depth is 6 millimeters.
So,
and for that,
I'm going to interrupt you. Sorry. So just to make clear, invasive PCI does not always mean that the brain is penetrated. So there are two ways of doing invasive PCI, right? So just to make clear for also our viewers that it's also possible to have just electrodes on top of the brain. So you open the skull and you put an electrode mesh on top of the brain, but you don't pierce into the brain. And then you have these micro electrode arrays that have, like, basically there are spikes, like little spikes that you put into the brain, and Neuralink is trying to have these spikes being more flexible, essentially, so that they do less damage, and they hopefully can stay longer in the brain. That's the idea, or at least that's what they claim.
Yeah, so this was actually quite interesting to read about, because there are a lot of different, it's called acquisition modalities or methods to gather electrophysiological data from the brain. And I think the very established ones that come from epilepsy research is stereotactic EEG. So that is just an electrode that is rigid, it's inserted in the brain. And the idea is for epilepsy patients to identify where a seizure foci might be. So this is very established since many years, because when they identify this foci, they can do a resection to remove the parts of the brain that are generating seizures. This is established in clinical practice. In addition, also what you mentioned, electrocorticography. This was actually the method that we used so far most in our research. And this is an electrode strip or a patch of an electrode that has multiple contacts, and it just laid on top of the surface. So it definitely is invasive, because you need to open the skull, you need to open the dura, so the skin that protects the brain, but you don't really penetrate the cortex itself. And the idea with Neuralink, with the N1 chip, is that there are the threads, and they go really, it's not that much, but 6 millimeters in the depth of the cortex. And I think that was one of the novelties that didn't exist so far, that there are specifically so many of those electrodes. And all of them contain multiple contacts that you can record from. And the idea is that they're that small, so they're really tiny, a couple of micrometers wide only, that they move also across the brain, they don't damage the brain, they're very flexible. And there are some other methods also, so this is used by a couple of competitors, just called the Utah array. That is a very rigid patch that cannot move. It has individual electrodes that look a bit like nails that go out, and you put it on top of the cortex. Which is, I guess, a bit more scary, but it was also shown in a lot of academic studies that this kind of electrode was very successful for speech decoding or other robotic arm movement. But maybe for the N1 implant, so what is definitely novel is that it's a really, really small form factor. It's smaller than a coin. It has all of the circuitry on board, so it does spike sorting automatically. And maybe to explain also, so when you record electrical signals from the brain, usually you have a very high bandwidth, so you can record many different aspects of the brain signals itself. And some of them might be just voltage fluctuations that are slower. Those are called the local field potentials that are not, so those are also generated by neurons, but mainly by the extracellular space around neurons. And in addition to that, you can also detect spikes. So the firings of individual neurons themselves. And on this implant, so the N1 implant, what was really cool is that they built a whole ASIC, so a specialized hardware chip that does all of the spike sorting, spike identification, all on the implant itself. So that reduces a lot of communication with an external laptop or computer, and all of it is happening in hardware, which is really energy efficient and still super tiny. And they also mentioned that this whole module is extendable, so the form factor should stay the same. I think they also had the first animal that they implanted now almost, I think, more than 2 years ago, that they just updated with another kind of software to do it a bit more efficient. So that's all
So
really
the
useful
animal
when you think of.
had the array in its brain for 2 years, the
Yeah,
electrodes. Okay,
um,
that's really
that
impressive.
was they always advertise that's Pager, the name, that did the task with so I think they called it mind pong.
Mm,
It's
yeah,
a
yeah,
ping
yeah.
pong on the
I've seen
screen,
that video.
and that, yeah, I think that was really impressive to see. But on the other hand, it was also shown beforehand almost 20 years ago, and humans even.
Yeah.
But it's quite nice that so this implant exists. Is definitely very scaled up compared to other approaches that were not available to neuroscientific researchers before. And what I think was for me most impressive was actually their robot, because they built the robot that can extremely fast just take some of the threads of the electrode and automatically detect blood vessels. So this is under the dura, which is a skin that protects the brain from damage, and then just insert them at the regions of interest where they think makes most sense to record signals from.
Hmm.
And when I saw the video, it also became pretty clear that they thought about the whole process, how this can be mass manufactured, how this can be brought to a lot of patients, that is not just a single case study. They even designed a specific drill for the for opening the skull. It's called the craniotomy. That is specifically for the form factor of the implant. And yeah, I think they also mentioned that they want to build an own clinic specifically for Neuralink products or patients that are implanted with that. I think what we should probably also mention is in the first keynote, and this came also was also motivated in their paper, is that the long-term vision of the whole implant of the product is not just for sick or diseased patients, but also for people that are healthy, to do some new enhancement to, I think Musk mentioned that also, that the motivation is to kind of deal with AI, because this
Merge, the
method
great merge.
will be too powerful for us. And there's also clear benefits of computers. They have more storage. And in the same way, we also mentioned all of the diseases, depression. And this was upsetting a lot of people in the neuroscience community, specifically invasive neuroscience community, because those claims are so far out there that it's very unrealistic.
Yeah. I think
to speak about that.
the thing that stood out to me the most, I mean, my background is cognitive science. So I also had parts of my studies were also about philosophy of mind and all that stuff. And the thing that stood out to me the most was probably that the CEO just casually said that the hard problem of consciousness is going to be solved with Neuralink's technology. And that, quite frankly, just means that he didn't understand the hard problem of consciousness, because by definition you cannot solve that with technology, because it's its own definition that it's unclear. So just for the viewers, very briefly, the hard problem of consciousness is basically to bridge the gap from, well, we can measure stuff in the brain, but why does it still, why is there a first person perspective? Why does it feel like I am something, someone? Why is there a first person view? Why is there consciousness as such? And that is the hard problem of consciousness, and there is no way to bridge that gap so far. And just saying, well, we have more data from the brain and therefore we bridge that gap, then that just means that they didn't understand it. And yes, Musk is no scientist, Chad. That's true, but there were people that are scientists at Neuralink, and they didn't stop them from saying this. So that means that either they didn't have a say, or yeah, it was just a very interesting thing to me. It's probably a minor detail in the grand scheme of what Neuralink was claiming, but to me personally, that was eye-opening regarding the thoughts that were roaming around apparently at the company.
It's probably also that in the direction of how you communicate as a scientist in general, and how you communicate when you are in business or in marketing. And as a scientist, I think people always try to be really humble. They try to make claims, but they also always discuss limitations, which you're also required to write in every publication. Or you need to discuss your results, put them into perspective. And you always have a peer review process behind every publication. And in this kind of event, you don't have to do that. There was no one kind of that commented on that. Yeah. And then specifically on YouTube, I also saw many people in the comments that were very, very hopeful and said, my aunt has severe depression, so I hope they have their first trials in the next year that she can still be healed. And it's something that was
not helpful for the field.
That sounded really, really unfortunate, that there was sometimes also this hope created or this hype around this product that I think shows also that it's not that easy, that it's only an engineering problem. Science deals with that for so long, and it's a bit different than I guess building an electric car.
Yeah, they were only looking for engineers actually in the beginning. They had no scientists. They were only looking for engineers, trying to hire machine learning people or electrical engineers and biocompatibility engineers, but no neuroscientists. It was really like, I checked the job openings in 2017 when they started, and I was like, this is super interesting, because obviously having 200 millions thrown into the field of neuroscience is going to have a big impact. But then there were no neuroscientists there were no jobs for neuroscientists. It was quite astonishing.
I mean, they definitely had some close collaboration with University of California, Davis, and they also had neurosurgeon. At least in the last keynote, they had some scientists explaining how movement control can be restored, or even vision for people that couldn't see, which is a really, really difficult problem. Was funny video where they showed a picture, and then on the left-hand side we have now with, I don't know, just a bit lower resolution, but this is what we can restore. And for that reason, they had scientists, I think, that now joined Neuralink. But the overall message was, that this seems very doable. And that's just something, I guess, people in science are not used to talk about this, or to listen to someone that is so confident.
Yeah, confident. That's a good word. Yes, confidence. He's definitely confident.
Yeah, I guess also that's part of the deadlines that he imposed on the company. And
I must say, I was really surprised when I heard that they got FDA approval. I didn't see that coming. I thought that they were still out there doing, I heard news about animals that were dying, and then I was like, okay, it's going to take a while for them. And that is impressive that they made it through FDA approval. Yeah, he's selling the American dream. Yes, that's true. So maybe we can entertain one of the questions from the chat. There was one a few minutes back, if you are up for that.
Okay. Yeah, sure.
So the question was, are there any workarounds on astroglia scarring? So my take is that this is a neuroscientist asking here. From what I learned during my bachelor, invasive BCI really suffers from signal loss due to that scar tissue. Yes. Are these arrays even deep enough in the skull to be affected by the scarring, or is it still an ongoing issue?
Again, I'm not an expert in glial cells or scar tissue around that. What I can tell though is that was also a big topic on the keynote that the engineers from Neuralink mentioned, that this was one of their biggest challenges they faced during the last year. And they showed also a picture how the scar tissue basically forms around the implant. And at one stage, the scar tissue might be so thick that it's very challenging to remove the implant because you would damage the whole blood vessel in the brain through that. And one further approach that they discussed was that they don't open the dura anymore. This is much more challenging than to see blood vessels through the dura. And they use a fluorescent dye that can eliminate blood vessels. But that's, yeah, so maybe that will solve this issue at least partially, because most of the scar tissue that is challenging for the whole healing process of the implantation is from the dura. If you only if you don't need to open the dura, that would be easier. So the threads go directly from the implant that is in the skull through the dura into the brain. And I guess that would not lead to so much scar tissue anymore.
Okay, interesting. Yeah, I did not know that. Yeah, I thought that they were still doing that. Yeah. To be fair, we're talking about the same guy that bought Twitter on a whim, then renamed it to X and laid off the majority of experts in the system. Yeah, but you know, actually, in 2017 that was not the case. Yeah, in 2017 Tesla was also still like undervalued, and Musk was a weirdo that was also regarded as someone who has these great goals, who couldn't didn't put anything forward at the time other than having genuinely interesting ideas. Yeah, so it was not clear at the time that Musk would develop to the person that he is now. I think much of his ego has been blown out of proportion from the stock market run of Tesla. That probably shapes a person in some way. He used to be, I think, more down to earth, at least from what in 2017. I must admit, I still liked his ideas. I also liked the fact that he invested in, or he created Neuralink, and I was also a fan of Tesla. I mean, I still am a fan of electrical cars, and I still think that Tesla did a good thing there, but Musk has really developed into something. It was not always like that. Sorry.
But I think the two things where I would really give him credit for is, first, seeing the idea. I mean, you need to imagine he comes from California in the US. At this time, there were no electrical cars. Everyone was driving their V8 muscle car. And this kind of changed. That he really believed in renewable energies at a time that was not popular. Even the German car manufacturers were all forced to go into electric.
That's true. Yeah, I mean, he
the competition
succeeded.
was so high.
Yeah, that was his goal.
That's a really positive trend, I think. And also with SpaceX, there were really big changes that rockets are reusable, and you can discuss if it's the right approach in case our Earth is basically suffering through climate change to just go through another one. But I think the engineering problems, or to make a business with SpaceX, is also, I don't know a lot of points there, but I think that also changed a lot with respect to what NASA does and the others. But yeah, I think I got also a bit more critical because at the keynote, it also seemed quite evident that he is not an expert in those domains, and he believes very much in terms of business, opposed to scientific knowledge. And I think it's still for overall for the field, it's still great. I mean, just the fact that we are discussing about it, and when people, I don't know, when I'm explaining to new people what I'm doing, a lot of people know Neuralink,
Yeah.
but almost no one knows deep brain stimulation.
Yeah.
And that's still nice that it's a discussion point
Yeah.
and it helps overall
Like with
the
this
research
chat.
field. Yeah,
Obviously,
exactly.
the fact that we are talking about Neuralink attracted people because they know Neuralink. If I had
Yeah,
said that we are discussing about deep brain stimulation, that
yeah,
probably wouldn't have worked as much. Yeah, but I mean, I must say,
or
there's something to it, right? So the idea, the vision of Musk is quite interesting, and he has shown with SpaceX, for example. Everyone was also saying, yeah, he's not a rocket scientist, so SpaceX will not work out because he doesn't know what he's doing other than doing business. But SpaceX does something now, and I think there is an argument to be made that in science people are also snobbish about this fact that
mm,
someone like Musk is coming in, swooping in with lots of money and no clue, and then there are some protectionist thoughts are running around as well. I mean,
mm.
ideally, it would work. It's not. It's not a bad idea in some like in his framework in his mental framework of like where he sees Earth, humanity, and AI and all that stuff. So it's
I
just that he
totally
has
agree.
kind of changed. So yeah.
Yeah, no, it's definitely true. Also, I mean, I mentioned it briefly in the beginning that some of this demonstrations of monkeys or humans controlling robotic arms was already published in 2002. There was a Nature paper
Mm.
from 2004 that showed pretty much exactly the same task they were presenting last year. This somehow shows that the technology or the companies didn't really pick up this kind of research, that it could be brought to a product, and that it's really an engineering problem producing that at scale.
Mm.
Because if you have a proof of concept that this can work for a couple of patients, it could be also brought to a wider patient population. And maybe they were also seeing that in the beginning when they founded Neuralink, that for a lot of the applications they want to build, that this was already done. But yeah, I think overall it's interesting to see where it goes now
I think
because
they
obviously
really see
any
the patient work only as a very, very early transitionary phase, right? I mean, they very clearly stated from the start that their goal is not to work with patients. They just do it because right now that's the entry point. But they want to really drill
Mhm.
holes into everyday people. They want to. He
Yeah, yeah.
mentioned that that brain implants should be as easy as LASIK surgery for eyeglasses or
Yeah.
like removal of eyeglasses. Which, by the way,
Yeah,
I'm also not a fan of. Obviously, I wear glasses, and I wouldn't want to have lasers cut through my eyes. But maybe I'm too scared.
but that's a typical example they mention
Yeah.
also, that they say in 20 years ago it was still really, really dangerous. A surgeon had to do that very long surgery operation,
Mm.
but now it's only a robot that basically does it, and it became really safe.
Yeah.
So this is just part of the iterations or different cycles that you can improve such a product also over time, just if you gather experience. And yeah, I think with AI, it's also so at this time, I think there was definitely no ChatGPT.
Yeah.
We all didn't really know about
But
large
there was
language models.
OpenAI. OpenAI was also founded by Musk, or including Musk. So he kind of. I mean, I must say he kind of saw it coming. That's true.
Yeah, yeah.
So yeah,
And that's already, I think, something quite remarkable to
yeah,
see such a trend before, yeah, even when people don't take you serious.
yeah.
And right now, people might see that differently, that there are studies that say, yeah, almost 80% of all office jobs can be replaced by large language models.
Yeah,
And if those improve, maybe the threat that Musk sees there might be based on evidence. So
it's kind of a spooky, like a Halloween thought in some way, right? There's the singularity idea is kind of based on the fact that we have no idea how it would work, but if it happened, then we would be too slow to change it or to control it. So everyone is just like, I don't know, I don't think it works, or I don't think it will happen. It doesn't make any sense. But then again, the risk, if it happened exactly the way that Musk envisions it, is kind of substantial. So yeah, I can see the mental framework that he's operating in with this whole idea. I'm not saying that I agree, but I can see the framework. It does make sense if you subscribe to the whole idea. And he's consistent.
Yeah, I agree. Also, I think the craziest thing for me is in the last years to see how fast AI changed.
Yeah.
And that's just, I don't know, 3, 4, 5 years. And they had such crazy progress that people wouldn't think that it would be possible.
When I studied,
we don't know how.
When I studied cognitive science, there were also some lectures about linguistics and obviously AI and stuff. And at the time I started 2009, so it's not that long ago. And at that time, it was like completely ridiculous to suggest that a tool like ChatGPT would be there in 10 years. That was like absolutely, no. Actually, had I known at the time that this would happen, I might have actually focused more on that part of cognitive science than on brain-computer interfaces. I mean, I love what I do, but that was at the time. That was actually what I wanted to do. I wanted to do something like this idea of what is consciousness, what simulates, like how, like what does it mean if we can simulate a human mind to the degree that we can't distinguish it anymore, which we're not there yet, right? But we are way closer than what I thought in 2009 when I started.
Yeah, I think you were definitely not alone with that thought. That even I also saw this one letter from Geoffrey Hinton and other basic founding fathers of some of the tools that people use in machine learning now, that they were also afraid. How surprising it is that zero-shot learning works so well in these methods, so that you never train such a model on this specific task, and it still works, and it still passes most of the tests. So it can program better than most programmers. It passed even the bar test for lawyers from the US. So in many aspects, it's already outperforming humans right now. And if those tools improve, then a large part of population might probably be unemployed. And I think that's something which might now still sound like science fiction, but maybe in 30, 40, 50 years, that might become real. And that's, I think, this kind of long-term vision that Elon Musk had in mind.
Yeah. So as a programmer, challenge accepted. Yep. I can see that. I mean, it's the same for scientists in some way, right? I've just recently seen an article about the use of ChatGPT in grant writing, and I can personally attest to the fact that yes, that's indeed a thing. We just handed in a grant proposal for a rather large grant here in Germany, and we were able to do that in literally superhuman speed, because the deadline was approaching, and like without ChatGPT we couldn't have done it. We couldn't use ChatGPT only, so we obviously had to feed it our own thoughts, but it could do all this, like we could feed our thoughts, we could put our thoughts on a Miro board and then use that and basically let ChatGPT like formulate it out so that it was a coherent human sentence instead of just some idea dropping. And the ideas were ours, but the fine-tuning was ChatGPT. And that's exactly the thing that takes otherwise a lot of time. And obviously you still have to proofread it and all that stuff. But it's really impressive. There's a lot of
I agree.
open potential that we are still only learning to tap in at the moment.
But it might makes me also think that, I mean, this is also a really valid and very fruitful way to interact with AI. That it doesn't need to be through an implant. I mean, even for programming. So most of the time, I'm programming doing my PhD.
Yeah,
And then
same for me.
I used GitHub Copilot. I used GitHub Copilot Chat.
That did
I
not
really
exist for
figured
me.
out how fast I got through those tools.
Yeah.
But before I was skeptical that I thought, yeah, I don't know, I just had the limitations in mind. This is just, I don't know, trained on bad code. But it was, yeah, I think it accelerated the work speed in many different areas of our work. So the danger might be a bit that we trust the output of the models more than our own understanding of it. And specifically for research, I also found myself a couple of times that I just typed in a research question that I was not sure about, and then just used the result as I thought, oh, this is true.
Okay.
And there are some tools already, like I think Perplexity, for example, that also can give you sources or publications where it got this reference from. But in a lot of cases, for example, ChatGPT doesn't do it.
Yeah,
And
I mean, referencing in scientific, like a proper academic text is still not there yet. But I mean, if we're thinking about how fast it was, we're thinking the next few years, this decade, there's a high chance that this is going to be like a completely solved problem at some point. Especially now that there's also they rolled out again the access to the web. So if you are a Plus subscriber, then you have web access again with the Bing search engine. I have the Bing app on my phone. This is a sentence that a year ago I would have been laughed out of the room for. And now I have a Bing app on my phone. I'm actually not using it so much because I still just directly go to ChatGPT, but it's a legit thing to do now. Bing. What is Bing? It used to be completely
because of
dead.
art, right? Yeah. But I think it's actually kind of interesting also how different they designed it.
Yeah.
With the Bing AI, it feels that it's less hallucinating, that it's more kind of on point.
Yeah.
So you might use different language models for different tasks. With ChatGPT, it's really just write a text that sounds nice or that rhymes well.
Yeah. Yeah, there's always more complexity there, but I think we are digressing here because there are plenty of questions that we might want to talk about regarding Neuralink. So sorry for the sidetracking.
Another time.
Yeah, no, definitely. ChatGPT is obviously a thing that, I mean, everyone is circling around at the moment, and for sure, it's not going to be the last time this is mentioned in our here in the IXR chat. So let me quickly skim through the chat. I think there are no specific new questions. So maybe we can actually entertain a few questions from LinkedIn because there were quite a few people who answered to my post on that.
There was one about competitors, when I recall correctly, right?
Yeah, there was one. Yes, by Kilian Eder. I want to know what has the competition achieved since Neuralink showed their system off the first time so many years ago. I can't imagine they have been sitting on their hands either. Yes, that's a very good point. That probably has accelerated a few ideas.
Yeah, definitely. I looked up, I have also a couple of really helpful links. Maybe that would be cool to share afterwards.
Yes.
There was one blog post.
I can share the links.
Yes.
If you share them here in the chat, I can share them into the Twitch chat, and then they are also stored in the video. But I will also share
Okay,
them later
cool.
on the Discord, on my Discord, which is also the link to my Discord here. Is on the
Cool.
IXR chat thing. So if you, it's good to document that as soon as possible, because otherwise we will forget about it again. We don't want that.
Yeah, so I just looked up some of the, I guess, main competitors or main companies that do specifically invasive brain-computer interfaces. And I think one of the most interesting ones is called Synchron. So this is an Australian company that builds a stentrode. So this is a electrode array that is very similar to heart surgery or blood vessel surgery that expands. So it doesn't require opening of the skull. You just insert it in a blood vessel, for example, from the neck. And then you can also record brain signals from within the vessel. And they had I think, really nice publication. It's from 2016 by Oxley et al. Called Minimally Invasive Endovascular Stent Electrode for High Fidelity Chronic Recordings of Neural Activity. This was published in Nature Biotechnology, and they followed up with a clinical trial that is now conducted. So this was over 12 months and 4 patients already.
Human patients.
Actually, 4 patients.
Yeah, humans, not animal tests.
Yes, and
okay.
Yes,
That's
and they had
crazy.
also, I think, also ALS.
Okay.
Yeah, and that's published in JAMA Neurology. Came out this year, which showed that the device is safe. Also, the implantation was safe. That there were no side effects, and they could also decode basic activity, show the power structure with typical changes that we expect from invasive recordings. So this is already quite far ahead, I would say, that they are already 1 year inside of this trial. And yeah, I think that might be also quite interesting for Elon Musk. In the beginning, he even mentioned that this would be the most elegant way if you don't require such a severe surgery of opening the skull, but just enter the vein through a blood vessel.
Yeah, I actually expected Neuralink to do something of that sort, to kind of use the blood vessel stream, but maybe they just didn't find the right people. Because honestly, there's literally a handful of people on Earth who can do that, or not even, like no one really can, and like there is a handful of people who research on that. so it's difficult to get them, I guess. Yeah, even with lots of money.
Maybe it's also a bit of a battle of the different methods how to record brain activity. This is a completely new one, so it was already validated in scientific studies. But I guess there are also a lot of open questions because the brain moves the whole time. That's also an issue that Neuralink described. And that might be even stronger inside of a blood vessel when you have a very, you're right at the source of a artifact from the bloodstream. Maybe that's still enough to build brain-computer interface that can decode movement or decode even speech. But that might be challenging. I think especially for speech, you require quite wide coverage of brain activity that you want to record. And yeah, but nevertheless, I think it's one of the main ones that should be mentioned that is very far. The next one is precision neuroscience. So this was, I think, also from one of the co-founders of Neuralink.
Oh, really?
Who separated.
Okay, I wonder why.
Don't know why.
Yeah.
And they use an ECOG strip. So this is an electrocorticographical strip that is just size of a square centimeter, and it has around of 1,000 channels, and it's called layer 7 cortical implant, or I think layer 7 because the cortex is set up of 6 layers.
Yeah,
so
kind
that's
of
the 7th layer
name,
on top. and also a nice paper where they describe the manufacturing, but also the mechanical properties of this idea. And so far, it was also clinically tested in, I think, also in Boston at MGH, where they had patients that underwent surgery to remove a tumor, and at the same time, they inserted the electrode and recorded activity from those patients.
Yeah, that's a common thing, right? You always have another reason to open the skull. Normally, you don't open the skull only for a BCI. That's also very important to know, I guess, for the chat. We're definitely not there yet to open the skull of a person just for a BCI. There's always another reason. As far as I know, there's always another reason to open the skull, and that's why the operation is performed in the first place.
It's generally a big point also, because you basically always record signals from the sick brain that has either epilepsy or has tumors. So it's difficult to even make assumptions or compare that to healthy subjects. And most of the research or the data that we see or analyze comes from those patients.
There's a question in the chat that I find quite interesting, and I think that's something that many people are going to are thinking about, especially if they're not familiar with the neuroscience behind it, and that is, how far are we from being able to send data to the brain? And that's, I think, something that Neuralink is also claiming. I mean, they're stimulating, but there's a big difference between stimulating and sending data. And I think you are the perfect person to answer that, because you are using deep brain stimulation already. And I think that's a different thing from sending data to the brain. But I think you can comment that better than I can, for sure.
Yeah. So maybe to give a bit of a background for deep brain stimulation. So the areas that we record and stimulate with DBS electrodes are not the same that are used for those implants. We stimulate in a really different part in the basic ganglia, which is at the depths of the brain, almost so above the brainstem, even, which is a very old preserved structure of the brain. And people have found that there are certain signals in those nuclei that are pathological, that change their activity when patients are suffering from, for example, Parkinson's disease. So if we stimulate in those areas the same frequency, 130 hertz, very small pulse width, 100 microseconds, then we can alleviate slowness of movement, or called bradykinesia, or we can alleviate tremor in another nuclei in the basic ganglia.
So like that's bringing a sort of foundational synchronization wave into the brain that would be there normally, but the brain is not able to keep it up, or is not able to stabilize.
Yes. So that's for Parkinson's disease. That's actually I think a bit better understood, because there is a loss of neurons that contain the neurotransmitter dopamine. And because of this neurodegeneration, there's one aspect or one nuclei, the activity of that nuclei, missing in a whole network of the basic ganglia circuitry. And that creates pathological synchronization that can be reduced with stimulation. And this is specifically in the in one oscillatory frequency band from 18 to 15, 16, 17 till 28 hertz, called the beta frequency. And people observed when they stimulate, this activity goes down. And at the same time, also the symptoms go down. So that's a very nice link of the symptoms to the stimulation state. And independently, they could also show if you take medication, so levodopa, which gets, which replaces dopamine in the sick brain, that also this beta activity also goes down. which I guess is a good example of how such a disease can be tracked or how you can specifically intervene in that circuitry to treat or to treat that symptom. And I think that was
That's
one of
very
the
different
earlier
from
keynotes.
data, yeah.
Yeah, I think at the one keynote, Elon Musk mentioned that the electrode is now almost 1 million times better because the electrode is the size that is 1 million times smaller than the
Huh.
DBS electrode that is quite thick, that is very rigid. But
Yes.
for this treatment, it's actually perfect. It works really, really well. It was shown so many times, works in so many patients. Um, and that's one of the most established therapies, I think, for Parkinson's disease in
Hmm.
those late stages. But in addition to that, there are also approaches, and there's also a Nature paper that described that from a group from University of Pittsburgh, that you can also stimulate the sensory cortex, and by this stimulation, you can have a bidirectional communication with the brain. So this improves, for example, if you grab a glass of water, that if you have also the tactile feedback in the sensory cortex, that this improves performance in
Hmm.
grabbing objects or
Hmm.
controlling a robotic arm, for example. So this is also shown already, but so far Neuralink didn't demonstrate that they have this bidirectional communication. It was just basically the output pathway that they can restore movement. I think I recall also the video of a pig moving again,
Mm.
or the monkey controlling a computer.
Yeah. Yeah, but
But
in their vision, they want to be able to send images to another person like that you imagine or that you see and stuff like
yeah,
that. And I think this we really have to be very clear that this is not even remotely there, at least from what we can say right now. So
yeah,
sending real actual information like I'm going to download Kung Fu, that's not a thing. That's not a thing.
look at the metrics.
Yeah, at the moment, that's not a thing. And from all, at least I know, that's also not going to be a thing for quite a while. But we also thought that ChatGPT wouldn't be a thing. So who knows? But I think the brain is more complex than Musk had thought. Um, and it's also more complex than a rocket. So
Yeah, I agree. I mean, I don't know how rocket works, but I
that's
know the
true.
brain is very complicated.
Yeah, I think the brain can legitimately be called one of the most complex objects in the universe, probably.
Yeah, yeah, for sure. But they mentioned though one interesting aspect, which is restoring vision,
Mm-hmm.
and this is done through stimulation. So vision is processed in the brain through one part called the visual cortex, which is the occipital lobe, and they can stimulate specific points that can, it's called phosphine, that
Mm-hmm.
creates the sensation of illumination in the visual field. And by that, they have the idea that each of those points can resemble one pixel,
Mm-hmm.
and this could hopefully lead to, with the help of a camera and then the link to the implant, that they can somehow restore vision in those patients.
Yeah.
But
It's not
I think even in
unthinkable,
the
but it's very difficult, I'd say.
yeah, I think there are so many aspects about vision that are very, very challenging. That it's not just very feed forward uh, processing of
Yeah.
that information. Even how we perceive shapes or color, which is separated across multiple layers in the visual pathway.
Yeah.
Uh, uh,
So I want to entertain a controversial question from LinkedIn that I think is a good one to put out there. So it's kind of a common question between Sam Hosowski and Milena Korostenskaya. Um, Both are mentioning the challenges of FDA approval and safety and longevity. And so Milena is asking more about the implantable device, and Sam goes directly to the heart of it, like what happens if a person dies, and that can be attributed to the BCI. So it's a device-related death. How would that damage the field in this case? Not Neuralink only, but the whole field will probably suffer in this case if there's news going around, right? So it's a very difficult topic because scientists don't have control over what's happening there, but it might be that they're damaging the field.
You mean if Neuralink, if there's a death at a Neuralink, this could, that would be the more negative aspect of that there's negative hype.
For sure, yeah.
But I think the regulations of the FDA are quite strict. As you mentioned in the beginning, that they don't just grant to any company access that they can perform human trials. And also from the invasive research and invasive treatment and therapy of brain disorders, we know that at least for the brain stimulation or responsive neurostimulation epilepsy, that the treatment is quite safe. That if you don't interfere with, for example, stimulating in a brainstem, where breathing gets controlled, that you don't change vital functions or the neurocircuitry of vital functions. So it's quite unlikely, at least with the implant that they presented, that has a penetration depth of under 1 centimeter in the cortex, to produce such a result. Inflammation might be an issue.
Yeah, it's still an operation with an open skull, right? There's always this kind of risk, but that's different from the risk of like the BCI going out of control or someone hacking the BCI and then the person is jumping off a bridge or something like that. I think that's a different problem.
On the other hand, there are more than 100,000 people right now that have a deep brain stimulator implanted.
100,000 people?
Yeah.
Oh wow, I did not know that. That's crazy.
Yeah, I think it's worldwide. In China, South America, every continent established therapy.
I did not know.
Yeah, I can also find a citation for that, but
I trust you. This is fine in this case. No, it's just really, this is crazy. I did not know that there are so many people actively walking around and getting treatment from that. That's great, actually. That this is one of the very few neuroscientific research fields that have actually found its way to reality out of the ivory tower of science, right? That's pretty impressive. That's pretty good.
Also to show that it's safe. I think that's also an important aspect about it. And also the lab that I joined in Boston, they also did a study of, additionally to the DBS electrode, they implanted ECOG, electrocortical graphical electrodes, and they showed in more than 200 cases that it was completely safe, so that there are no adverse effects, that the brain didn't get injured or other aspects. And I think there are already a lot of studies that utilize the Utah array, that used other technologies, and they were also shown to be safe.
Yeah.
So I think that's not a very realistic scenario, that people might die through the implantation procedure. There might be changes, however, that are also described in DBS research, that are related to or adverse effects that are based on the stimulation. For example, in Parkinson's disease, people have they might have sleep disorders or showed more behavior to engage in gambling compared to before they implanted. which might be also attributed to the fact that they stimulate the dopaminergic
Yeah.
pathway.
Yeah.
And I guess a lot of people know that dopamine is also the reward circuitry. It's involved in motivation,
Yeah.
a lot of other cognitive aspects. And I think that is also something that would be very important to describe very carefully about those effects, what happens when they stimulate at specific sites. And yeah, but this was also done already, I think now more than 100 years ago with Wilder Penfield that
Oh
used
wow.
stimulating specific parts of the cortex, and he described sensations or flashing of light,
Yeah.
somehow recalling immediate memories that are very vivid
Yeah.
in front of them. Um, yeah,
Yeah, I saw a
that's,
video when I was studying about there was also an open brain surgery, and there were three different parts of the motor cortex and premotor cortex, and the patient. So depending on where you stimulated, the patient either expressed the wish to move their arm,
mhm,
or they moved their arm but didn't notice, which is like the straight up motor cortex, where that's fairly straightforward. Or, and that's the weirdest part for me, they thought they had moved their arm, but nothing had happened.
ah,
That's the
interesting.
sensory cortex, right? It was really like seeing that as a student. It was like, wow, the brain is really it's 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 so easy to disturb the function of the brain, and we have this coherent image of how we work and how our world is shaped and so on, but you just poke the brain at the right position and you are hallucinating like crazy.
Mm. Yeah. I think that's a really important point also, that it's very easy to disturb it, but to reliably impose
Mm-hmm.
function or to stimulate it,
Mm-hmm.
that you have the sensation that you now, or that you move a robotic arm when you think you move the arm,
Mm-hmm.
and also recall it as such an event, actually really complicated.
Yeah.
And there's a lot of circuitry, even in those very basic motor control, that is not understood,
Yeah.
that people are studying right now. Um, yeah, so maybe that's an aspect that those companies overlook, but it might be also, on the other hand, also a really valuable research tool. If you have thousands of electrodes with, I think they mentioned that they wanted to extend the implant with up to 20,000 channels. That's really amazing
Mm.
for any lab that studies invasive brain signals,
Mm-hmm.
to see this
The
kind of
data
data,
set,
to
yeah,
see,
the gigantic data set that we can get access, or they can get access to,
yeah,
yeah.
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 Yeah, they also asked him at this keynote if they could open source their data. So far, they didn't do it, but
Yeah,
I would really love
I don't
to
see
see
that
it and to
happening.
work with them.
I mean, that's probably
Yeah.
their business model at in some way, right? So like getting the
You
data
pay for the
and
data.
yeah, and having their models going beyond what research can do, because they are investing into getting the data, so they want to, I mean, open science is also not open AI. Yeah, open AI is also not open anymore, right? They don't share
Yeah,
their
true.
data. They share their framework and all that, but it's useless if you don't have the data. So I don't see that happening. um,
Yeah, maybe, I don't know
yeah.
if they pressure enough, but even then.
No, I
uh,
don't think you can pressure Musk into anything these days. Yeah. So we have a few more minutes now, and I think what I would like to do is talk about the like your view, or the maybe you, I mean, you can't speak for everyone, but there's probably some sort of scientific consensus about what even is possible, like
mm,
Musk's vision, keynote speeches and so on. Parts of that are thinkable, like legitimately possible if the technology advances enough, and some parts are probably way out there. And I think that would be really interesting to kind of sort this out. Obviously, we can't answer that for sure and all that stuff,
Yeah,
but
yeah.
but like this whole idea of assuming that Musk is going to continue, or Neuralink is going to continue in this direction, and assuming that AI is going to be also much more powerful at the end of this decade, maybe we will have we will have an option to kind of piggyback on this one-shot learning idea of LLMs and apply that also for neural data and all that stuff. Like, imagine if it worked. Imagine there are people that get implants and literally merge their minds.
Hmm. Yeah, I think that's a really, really nice way, or a really nice point of discussing also some of the very recent advances that were presented in the field of invasive brain-computer interfaces. We mentioned that there was a lot, or there is a lot of hype about Neuralink and about what they presented, that the monkey plays ping pong just with their brain. But I think specifically this year, just if you look at some of the publications, what have been shown, it's very remarkable what kind of progress people did. For me, the most interesting one was, so that's just published, I think almost 1 month ago in IXR, was about depression that they had. And so in the US also, that's a lab from Helen Mayberg. It's a paper called Cingulate Dynamics Track Depression Recovery with Deep Brain Stimulation.
Okay.
So that's the same method of DBS. And they have had over a course of more than 1 year patients with medication-resistant depression. They're very severely affected. So they get ECT, electroconvulsive therapy, suicidal. Also a really great podcast about one of the patients that was participating in that study. And for those, adaptive deep brain stimulation helped 90% of them, well, I think it was 7 out of 8 patients to go into remission, to be completely symptom-free.
Oh, wow.
And that became possible through such a technology. In the same way, there are also this year 2 Nature papers talking about speech decoding. They had ALS patients that are unable to speak, and with 2 different approaches, one with the mentioned U-Way and the other one with so it's a lab from Eddie Cheng of UCSF San Francisco that used ECOG arrays to had very high performing speech decoding that they showed with data set from more than 100,000 words with an error rate of just 25%. The speech can be decoded from those patients. And yeah, I think those are points that are sometimes a bit overlooked, that are not really celebrated in the public that much, but they show really crazy, remarkable proof of concepts of also the potential of this technology. And therefore, I'm quite confident that if we see more and more, we mentioned already that more than 20 years ago, people could move robotics arms just with thoughts, that even tracking or kind of alleviating symptoms for psychiatric disorders like depression become possible. And
so that's one of the things that Musk also talked about in his keynote, and people were kind of condemning him for that. But that may be one of the things that he could deliver at some point.
Yeah, I agree. And a lot of time, so when you're a researcher, then the proof of concept is the most important thing. You want to demonstrate that the technology or the idea you had with the data acquisition, building strong decoder, that it basically just works. And when it works, kind of the end of the study. Then you have maybe a nice paper that is published in a good journal, but you don't build a product now out of that. And this is, I think, exciting that there are companies like Synchron, like Neuralink, that pursue that direction. And they mentioned also many times that this path from prototype to product is really complicated, and that's potentially even more challenging than just building one or a single prototype or proof of concept. But that's also for the whole field of invasive, so for implants, for brain-computer interfaces necessary. And yeah, so therefore I'm generally quite positive. I'm quite excited about those companies. I'm really excited about the FDA trial. Hopefully also they are presenting their keynotes about the challenges they encounter. And I'm also happy that there are those different approaches, that it's not only this one company that has now a monopoly in this area, but some are relying on ECOG arrays, some use Utah arrays. Neuralink builds individual threads, which is completely different than the previous approaches. Synchron that uses blood vessels. So there are many ways that kind of tackle the same problem. And I think it kind of remains to be seen which kind of a modality could be used best for decoding or bidirectional closed loop interaction for brain-computer interfaces. With another aspect of neural enhancement, I think that's something that is scientifically not so well studied also. Maybe also because there's the missing funding.
The missing ethical. I mean, it's difficult to get ethical approval for non-medically necessary operations and all that stuff. So yeah,
for good reason also.
Yeah, of course.
There's a lot of risk associated with that. It's still surgery. So that's one aspect that is, I think, not so clear at this point, or there's no data that can suggest that some of the interface with hard disk storage or just saving a brain state, reloading at one point, or telepathy is possible at all.
Yeah,
I'm quite critical about those aspects, but about the future direction of treating diseases, movement disorders, psychiatric diseases, I think that is very well possible because it was already shown before in other studies. And so that's very promising.
Interesting. Thank you very much for this very interesting, nice statement at last. So it might be that Musk's ideas are so out there that he just inadvertently solves a few medical problems, but maybe cannot deliver on his actual ideas. But that's not too bad, isn't it?
That would be great.
Yeah, solving
a good scenario.
Casual drive-by depression solving or something. But that remains to be seen for sure. But it's a very very interesting field of research at the moment, and I agree that there's a lot of research going on now and different approaches, and it might be that they were at least in parts sparked by the fact that Neuralink exists now and there's a substantial money flowing into the field, and others are trying to keep up. So with that being said, I would like to wrap it up because I need to go, unfortunately. It's great that we could meet, and I would actually prefer to stay longer because there are quite a few open questions and the chat and also all that stuff. So I think that's not the last time that we saw. At least
no, I think when they have a new keynote, present new results, I'm very happy to.
Yeah, absolutely. Yeah, for sure. You will be my Neuralink person from now on, if you want or not.
Yeah, thanks a lot for having me also. It was really fun. It was very interesting conversation. A really great topic. And
Yeah.
yeah,
Yeah, thank you so
thanks for
much
having
for
the
your
format
time.
also.
Yeah. No, it's really something that I really care about, this kind of transparent research discussions that the public might also find, yeah, topics that the public is curious about and so on. Yeah.
Yeah, totally agree.
Okay. Thank you so much again, and thank you, chat, for being there, for answering, for asking questions, and yeah, just being there and engaging with us. That was great. I look forward to the next time, and I can already spoiler that the next time we'll talk about language and conversational AI interfaces. So the topic of ChatGPT for sure will stay within this IXR chat framework at some point. And yeah, I don't have a specific set date yet, but I will post it on the Discord, which obviously everyone is invited, including you, Timon, to join in, and I will post updates there and invite to the new events and all that stuff. Wonderful. So I wish
Great.
everyone a great evening. I wish you a great evening. Thank you again for your time and for the very interesting conversation. And I look forward to
Thank
the
you.
next time.
All right. Have a good evening.
Have a
Thank
good
you.
evening. So I will
Bye.
transition to the end now.